Okay, here we go again. So I'm going to try to answer your questions from the discussion boards for the last couple of weeks. So I've grouped them actually just the last 2 weeks. So I've grouped them into categories that made sense to me. So we're going to start off with causes of stuttering. So one of the questions that came up is that there were a couple of different answers in the videos versus in the book about when stuttering is likely to emerge. So the stuttering is a disorder of childhood, and we call it developmental stuttering even if the person is 50 years old and still stuttering. If it's developmental stuttering if it started in childhood. So the majority of data indicates that the onset of stuttering is somewhere between 2.5 and 3 years old, so between 30 and 36 months. That being said, it can develop as late as 6 years, and even I have seen in one text something that even said it is up to 14 years, but the older you get, the less likely it is that stuttering will develop. The most likely time for uh, children to experience stuttering is in that 2.5 to 3-year-old developmental period where they're experiencing the language and vocabulary explosion. So if you think about it from a broader developmental perspective, between the ages of 2.5 and 3 are when children really start using language to learn language. So they're putting together 2 and 3 words, and for some children, many more than that. And their vocabularies, in terms of expressive vocabulary and even receptive vocabulary, are exploding, going from having hundreds of expressive words to literally thousands of expressive words. So in general, the when I think of what is the age of emergence for developmental stuttering, it's around 2.5 to 3 years old. However, it may happen anywhere between I would say 2 and 6. Okay, so another question that came up, and I think it's probably one of the most commonly asked questions about stuttering, is what causes stuttering? And one of the answers that I hear the most is we don't know. So I want you to, for a moment, to consider what causes depression, anxiety, autism, cerebral palsy, developmental language disorders, childhood apraxia of speech, articulation and phonological disorders, Tourette's syndrome, or stuttering. And the answer is there is no simple answer. These are complex neurodevelopmental disorders that result in specific sets of behaviors. So stuttering is exactly that. It is a multifaceted neurodevelopmental disorder. So one of the other questions was, how can we increase awareness about the different causes of stuttering and treatment strategies? So I think one of the things that I would love for us to do is when someone says, well, what causes stuttering? Instead of us saying, well, we don't really know, I'd love for us to say, there is no one single cause, but here are the things we know that contribute to the development of stuttering. I'm going to talk about this in the next slide, the genetics versus environment um, conundrum. So, how can we make people more aware? By being more aware, by understanding the multiple factors that come together to create stuttering. So, the reason I picked water droplets for this particular slide and lots of different water droplets is there are there are lots of properties of water that, and one of them is called cohesion. And what that means is that water sticks to itself at some point, and water sticks to the surface of other things. At some point, when enough molecules of water are stuck to a surface, they become too heavy and they drip. And I think of stuttering in a similar way. It takes a preponderance of factors to come together before an individual goes from being a person who doesn't stutter to a person who does stutter. Again, the same as water droplets. There are lots of different factors that come together that determine at what point it's going to drip. And then just for fun, I put a cell with the nucleus up in the corner because again, it may be the unique combination of DNA that results whenever two humans come together and create another human. So the other question, or another question was, has awareness about stuttering made people more accepting of stuttering? I think yes and no. I think it's like so many things that we have had an awareness about recently. I think that this particular point in time, there are lots of things we can think of that that many of us have come to be aware of that maybe we weren't aware of before. And it makes us, I don't want to use the word aware again, but that's the one that's coming to me. Um, it makes us realize that there are lots of things that we don't know. And so awareness is only the first step toward understanding and accepting. So, uh, is the awareness about stuttering, is that easier for parents to accept stuttering? No, and I'm gonna yes and no, I guess. I think more like no, but and I'm gonna talk about that several slides from now. Um, and actually, I should probably save this one too. Like the idea that should discipline be the same for a child who stutters? And the answer is yes, that a person who stutters is a person first. Even if so in terms of ableism and identity, even if um, you use the term stutterer, which is fine, uh, there are lots of other characteristics to an individual other than the fact that they stutter. And stuttering does not make a child breakable. It means that their speech is disrupted in a certain way. Whereas um, I'll circle back to that. I'm not going to get into that right now. Okay. So one of the other questions was, are there instances where stuttering is acquired? And the answer is yes. There is what is called neurogenic stuttering, and that is stuttering that results after a injury of some kind to the brain. And sometimes that injury or difference in neurophysiology can be caused by medications. Sometimes it can be caused by traumatic brain injury or vascular injuries or even anoxia. But neurogenic stuttering is stuttering that it usually happens outside of childhood, and it is stuttering that has its onset following a neurogenic event, a very specific and identifiable neurogenic event. So another question was about blunt trauma to the larynx calling or causing development of stuttering as a result. So my guess would be that that kind of stuttering would, like that kind of trauma would lead to more blocking type stuttering than, say, iterative stuttering, like a sound or syllable repetition or monosyllabic whole word repetition. That would be more of a blocking or prolongation where the vocal folds, essentially you have vocal fold dysfunction and abnormal opening and closing that is contributing to the occurrence of blocking and prolongation. Okay, another question is if a child has a great number of factors that affect the cause and continuation of a stutter, do they have a greater risk of having a stutter? So um, please reach out to me if this is not what you meant, but I am interpreting this question as asking if you have more risk factors associated with stuttering. And let's say you have a child who has um, a receptive and expressive language impairment, as well as a family history of stuttering and a highly reactive temperament, and yeah, and has started to stutter, then yes, that child would be at a greater risk of continuing to stutter rather than spontaneously recovering. So there's actually an instrument called the Stuttering Prediction Instrument, and it's pretty old, but it and there are other instruments that I believe the test of childhood stuttering has some elements to this where it helps you quantify the number of risk factors that you are documenting in your evaluation to come up with essentially a risk assessment. Is the child at low to high risk of continuing to stutter without treatment? And so, again, really long-winded answer to the question, if you have more risk factors or you're more likely to continue stuttering. Yes, absolutely. What are some examples of cognitive factors that influence stuttering? So um, we know that children with Down syndrome tend to stutter at disproportionately higher rates than kids without Down syndrome. So I don't remember what the percentages are. If one of you wants to look that up and share it with me, I would be grateful. Um, but what we know is that speaking is a highly coordinated, highly complex task. So, whenever you have a cognitive impairment that may result in difficulty retrieving or producing words, um, or planning words, then it's probable that stuttering could be one of the results of that. Okay. So that leads to the next question is, are a child's expressive and receptive language skills both affected equally? No. So one of the things your book talks about is there was a meta-analysis done by Dr. Katerina Naturo and some other folks out of the lab at Vanderbilt. And they found that when you compared uh, the scores on the expressive vocabulary test, the Peabody picture vocabulary test, the test of expressive language development, or another measure like that, that kids who don't stutter tend to score higher on those measures than kids who do stutter. Now, the thing to remember with that is not to say that all kids who stutter have language impairment. So for example, let's say there's a 5-year-old child who doesn't stutter and they score a 115 standard score on the Peabody Picture Vocabulary Test, so the PPVT. What this finding tells us is that compared to that 5-year-old child who doesn't stutter, the 5-year-old child who does stutter would score um, it's a 7-point difference is what they found. So they would have scored a 108, which is still well within normal limits and actually, is on the higher end of normal limits. So that's something to really keep in mind. It's not that people who stutter or have language impairment, it's that they tend to methodically score lower on tests of language than their non-stuttering peers with all else being equal. Okay. And all right, so to back up. So if you have a person who stutters who also has a language impairment, it's the same as anyone else who has, I don't know, autism and a language impairment. There are different aspects of language that are going to be more impaired than others. Or they may be impaired the same, but what usually happens is that one skill is better than the other. All right. One of the other questions was, why do people who stutter perform worse on auditory tests? So there is a theory of stuttering called the covert repair hypothesis, and it's a theory that was posited by Postma and Kolk. I think in the late 90s. And the idea is that we monitor our speech while we are speaking and prior to speaking. So, hold on, got to pause. Okay. So the question is, why do people who stutter perform worse on auditory tests? And I was talking about Postma and Kolk and the covert repair hypothesis that says we monitor our speech both internally and externally. So, sorry, went up and down the stairs, and of course now I feel like I'm going to die. So one of the ideas is that people who stutter have a hypervigilance to auditory input. And so that's where in the King's speech, where he puts on the headphones and he is ignoring the auditory input, he doesn't stutter. We don't know why that's a thing, but it is. And that's why delayed auditory feedback works on people who stutter, and why it can work in the reverse on people who don't stutter, where you can, someone who stutters, uh, with delayed auditory feedback on, will may stop stuttering, and someone who doesn't stutter with delayed auditory feedback um, may start to stutter. So the second part of that question is, um, how does what effect does hearing have on stuttering? And and the question's related to deaf people. So people who are deaf or hard of hearing absolutely can stutter. They can stutter in sign language. In fact, stuttering occurs in all kinds of languages, including nonverbal languages like sign language. And if you're really interested, send me an email and I'll send you the article I have about stuttering in Flemish Sign Language, because it's pretty interesting. So to me, that's one of the things that speaks to the multiple factors that relate to stuttering, that it has both a linguistic component and a motor component, because you see it in nonverbal language as well. All right, so moving on to my next slide. So there were a lot of questions about genetics and the environment and stuttering. So I think kind of the most common question was about which one affects the onset of stuttering more, the environment or genetics. And the answer is that we know there's a genetic link to stuttering, and that roughly 70% of people who stutter will have another family member who stutters. And that's what we see in twin studies, whereas in identical twins, there genetics accounts for 70% of concordance, which means, though, that there's this 30% piece that is something else, which is an environment. So one of the other questions was, why isn't there even greater concordance in identical twins? So, and what concordance is that if if one identical twin stutters, then the other one absolutely does too, because they share the exact same genes. The fact of the matter is, though, that even in utero, environment is different. So you guys don't really know me, but I have fraternal twins. So I have a set of boy-girl twins. So they obviously don't share full genetic material. Uh, but that being said, depending on, even in twins who are identical, where the embryo implants in the uterus can um, can determine how much of the nutrients that they get, whether, for instance, my boy twin was transverse on top, and my girl twin was double footling breech in the bottom. So kind of picture he was laying on top of her sideways as she was crouching. All right. So picture that as environmental difference. So um, the point is that the environment, even in the womb, is different, even if you have the exact same genetic material working together. Um, not all placement, not all umbilical cords, not all placenta are created equal. Okay. Oh, come on. All right. Just stop share, reshare. Okay, if you're hearing heavy breathing in the background, that's my dog. I have a 110-pound lab, and he's older, and he just came up the steps. So he sounds like me after he's come up the steps. A little bit of heavy breathing going on. Okay. All right. So I talked about concordance. Oh, so genetically, so we know that 70% of people who stutter will have a family member who stutters. That means that 7 out of 10 people who stutter will have a genetic link, and that means that 3 out of 10 don't. So for those 3 people, the environment is the greater contributor than a genetic influence. Um, like so many things with stuttering, the does environment play more of a role than genetics? The answer is it depends. But the two interact to determine whether someone is a person who stutter or is not. All right. So, um, one of the other questions is if some people believe that stuttering is not caused by genetics, do they believe it's just learned behavior? Um, so there are, before we really got a lot better at genetics, we didn't really know what kinds of things cause what. And even now, even that now that we know so much more about genetics and we've mapped the human genome and all of that good stuff, it we still don't know what the effect of even slight changes in um, genes or sequencing uh, contributes one way or the other. So, and we also know that, so the analogy that my mentor used to use is that genetics loads the gun, but the environment pulls the trigger. Okay, and that's not any kind of commentary on guns. That's just in the analogy, is that the genetics determines what's there, and the environment is what triggers the expression of a gene, of a genetic propensity or not. Okay. Um, All right, so that leads into talking about environmental factors. So when people talk about environmental stressors, the question is, does that include the family size, who lives in the household, communication styles, or how well the family gets along? Absolutely. Those are all great examples of potential environmental stressors. And if you think about this in terms of what makes it easier as a speaker, as a non-stuttering speaker, under what conditions is it easier for you to talk? And when your environment is not stressful, it's easier. So if you add on stuttering or language, like developmental language disorder or autism, or many of the other communication disorders of childhood that we treat, anytime you load environmental stressors into that situation, the more difficult it's going to be. Okay. So how, as a clinician, can you address environmental factors like conflicts in the family or birth of a new sibling that could be stressing the child out? Sometimes you can't. Sometimes that's just um, the circumstances that a family is experiencing. But one of the things that we found in working with families of preschoolers who stutter is sometimes it just is helpful to know what circumstances are going to potentially make your child less fluent. And what are you going to do in response to that? And sometimes there's not much you can do. Um, and I'll get to that later on when I talk about the stuttering in your child video later on. Okay. So the other thing that we can, or things that we can do, and I'm going to talk about this later too. So just hold on. I'll get to it, I promise. So I'm going to move on to the next slide. So a lot of you felt really hostile about how the stuttering in your child video um, didn't spend a lot of time talking about the neuroanatomical and neurophysiological aspects that we have identified as being different in the brains of stutterers. So my my thoughts on this are many. So it is extremely interesting to know what kinds of potential neuroanatomical, neurophysiological um, differences are occurring in the people we treat. But in the end, we are not neurosurgeons. We have not gotten to the point of being able to do gene therapy. So at the risk of truly offending your sensibilities, I'm going to say at the end of the day, it doesn't matter because what we are tasked with treating are the behaviors. Now, when it comes to something like a stroke, knowing the site of lesion for the uh, where the stroke occurred is really helpful because it will help explain some of the behaviors that we're seeing. So in that regard, maybe it is helpful for us to know um, what underlying neuroanatomical and neurophysiological things may be going on. But at this point, it's not really helping us understand how to treat stuttering differently than uh, than how we treat it. And in the end, it's what's in front of us that we have to treat, whether we know where the site of lesion is or don't know. All right. So would I explain to a parent, well, your child's brain is just wired differently? Yes, I probably would. Would I talk about differences in white matter versus gray matter in the arcuate fasciculus and the corpus callosum and the unusual activity in the speech correlate areas, but on the right hemisphere? No, um, I'm not sure that that's particularly helpful to parents. And you have to be really careful too, because you don't want the takeaway point for the parent to be, my child has brain damage. Because when someone walks away with the message, my child has brain damage, their expectations for what their child may or may not be able to do are very different than if you say your child has um, your child is stuttering. And what we know is that stuttering is not correlated to how smart or capable or successful they will be as a human being. Anyway, just points to contemplate. Um, so do I believe that that this is information that should be shared? Again, I think I would be really careful about how you share it and make sure that um, the message is that not that your child has brain damage, but your child may have a brain difference, and that's why their speech is the way it is. Um, Okay, and then the second part of that question was, is the production regions happen only while the person is actively stuttering? Interestingly enough, the activation, the preference for right side activation versus left side activation is present even during non-speech tasks. So in adults anyway. So for there are several fMRI studies that looked at reading tasks or where the person who stuttered had to, I think the way it worked was they had to read a sentence and then think of a sentence, like think of formulating a sentence in response to a question or something like that. And what they found was even in a formulating non-speech task, these same sorts of um, right hemisphere activations are present. So kind of interesting. Which again goes to me speaks to the fact that stuttering is not just a motor issue, that it is something that starts in the planning and processing aspect of speech language production. All right, so I'm going to move on to the next one and talk about stuttering and emotions. All right, so you guys had lots of great questions about this one. So one of the overriding themes was, does anxiety play a bigger role in stuttering than we actually think? So the research has shown us over and over and over again that that stutterers are not more foundationally anxious than any other person. That what okay, that the anxiety is tied specifically to speaking tasks and is a result of the experience of being a person who stutters. So, for example, my son is on the autism spectrum and is also a highly anxious human being, and he doesn't stutter. Um, he, uh, but he is anxious all the time. He is constantly worried about everything. So to me, that's what I call, and this is not the technical term, but the way I think of it is foundational anxiety. Like he has I guess it's the right term is generalized anxiety. So people who stutter do not have a higher prevalence of generalized anxiety than anybody else does. What happens though is the experience of being a person who stutters creates anxiety around speaking situations. And since speaking situations happen quite a bit in our lives, there's a lot of anxiety to go around. Okay, so Another question was, has there been any extensive research on how emotional stressors or changes, like having a new baby in the house or moving, trigger disfluencies? Well, I think about it this way. It's a disruption in the normal flow of things. And for any of you who have ever been around a new baby or had to move, you know that it is incredibly stressful and it completely upends your life and your routines and everything else. So if you are prone to any kind of distress, it's going to show itself under those conditions. So to me, it's not surprising at all that um, so one of my favorite theories about stuttering, it's not one of the most measurable, but to me it's one of the most easily explained, is and I believe it's covered in your book, is the idea of capacities and demands. So our genetics, and this goes back to genetics and environment, we come into the world with different capacities for everything, um, different capacities in our metabolism, different capacities in how tall we're going to be, different capacities and um, cognitive potential. And then our environment um, either supports or puts demand on those capacities. So maybe you came into the world with a genetic capacity to be 6 feet tall and lived in an impoverished uh, nutritional state for the majority of your life, and you only end up being 5'9". So uh, again, that's the capacity, was that you could have been 6 feet tall, but the demand of your environment and the lack of support in your environment did not you didn't reach that capacity. And it works in the other direction too. So if my capacity for stress is at a certain level and I keep adding things onto it, at some point I'm going to exceed my capacity for stress. And perhaps as graduate students, you guys are finding where the demands have begun to exceed your capacities. Um, for dealing with it in really the most healthy ways. And so for me, when my capacity for stress is exceeded by the demands of my environment, that's when I'm going to chow down on peanut M&Ms and orange soda. So there you go. Um, Okay, so in terms of stuttering, capacity and demand is something like a move or something like a baby being born is a demand in the environment that may exceed the child's capacity to be fluent for a variety of reasons. Okay, so one of the other questions was, what ways can an SLP serve as a counselor with a client who stutters if we discover that the client is suffering from depression and or anxiety along with their stutter? So our job is to treat things in the context of their influence on communication. So this is where, and this leads to the next question. Do SLPs work with psychologists for a client who stutters? If so, what's the extent of their collaboration? So I highly recommend you find the child psychologists, clinical counselors, social workers, mental health providers in your area, get to know them and get some interprofessional collaboration going. Because as a speech language pathologist, I can talk about, tell me how your stress and anxiety impacts your speech. And I can talk about ways to um, help change thinking around um, around speech and around communication, but I cannot treat your trauma. Um, I am not qualified to treat the trauma that you have experienced as a result of um, being a person who stutters or experiencing the vast myriad of other kinds of traumas that people experience. So I would say, especially considering the trauma that we know has been a result of the pandemic, and also, again, coming back to that awareness and acceptance, knowing that there are lots of traumas in the world. We need to have great working interprofessional collaborations with mental health providers, not just for our clients who stutter, but having a communication disorder of any kind is a big deal, and it is a trauma. It is a trauma to families, because we live in an ableist society, and we may get into talking more about ableism and stuttering later. Um, but if not, I want you to start thinking about that. Like, how does an ableist society impact on the families of the people we work with and the people we work with themselves? So absolutely, you should collaborate with mental health providers often. Um, so that is related to another question about working with a counselor. I think I just covered that. Does if a patient is able to change their views or feelings towards their stuttering, will this cause an immediate decrease in their stuttering? Not necessarily. It really depends. So, stuttering in preschool, and one of the reasons why the stuttering in your child advice for parents talks a lot about changing environmental stressors, is that for some young children who start to stutter, making those basic changes in environments where the demands of the environment meet the child's capacity to be fluent can keep the stuttering from becoming persistent. That's not always the case. Um, but what it does when uh, families are accepting of the stuttering, uh, it keeps the act of stuttering from um, having a negative impact on the person who stutters. Um, and that's the goal. To me, and this is something that my mentor, Dr. Ed Contour, used to say all the time. And um, I don't know, maybe it's because I heard it so many times, but I firmly believe this, and you will hear other people who've worked a lot with people who stutter and are SLPs say this: we do not speak to be fluent. We speak to communicate. The whole purpose of talking is not perfection, it is communication. And our goal as speech language pathologists is to make sure that our clients meet their potential for the easiest form of communication they can. And sometimes for people who stutter, that means not being stressed out about stuttering, that producing stuttered words is not a big deal, that it is simply part of the way that they communicate. And to me, that is the ultimate goal of stuttering therapy, is that the clients communicate exactly what they want to say, when they want to say it, to whomever they want to say it to, in any circumstance, because that's why we communicate, not to be fluent. Okay. All right. So, one of the other frequently asked questions is, why do people who stutter more on some sounds versus others? So, there is a term called anticipation that I'm going to use a completely non-stuttering example. So, you know how athletes will wear their, and maybe you guys do this just as students. You have your lucky pencil or your favorite mug to when you're studying, or the socks you always wear when you have to take a test, or the chair you always sit in if you're sitting in a classroom, or for online learning, the chair you always sit in to do your work. That's the magic chair. That's where your karma lives. And if you, and so let's say that you've been, since you've been at home doing classes, every time you sit in this one chair, um, the leg breaks, or you get cold, or you spill your coffee, or your laptop dies, or whatever, something bad happens. So you're not going to sit in that chair very many times. And when you sit in the chair, you're going to anticipate those things happening. So it's a very similar thing. If you've had the experience of stuttering on a particular word or sound, over the course of time, you're going to believe that that sound is a problem for you, and you're going to anticipate stuttering on that sound, and that anticipation makes you more likely to stutter on that sound. And that's why it's not the same sound for every person who stutters. It really just depends on the person and what their experiences have been with particular sounds. Hope that made sense. Okay, so this leads us to, so what do we do? So a lot of your other questions really kind of fell into this. Well, you know, if this, then that, so what now? Um, so I just kind of put them all in the category of what do we do? All right. So, how do we serve people who stutter? So, that's the big question, isn't it? How do we serve people who stutter? Um, the most important thing you can do for people who stutter and their families is listen. Listen to what their concerns are and address them. Listen to what their goals are and address them if you in any way that you can. It is and always should be a collaborative process. Um, one of the questions is it more important as an SLP to help clients learn strategies to improve their speech, or work on a client's self-confidence when speaking with others or in public? So those two things aren't mutually exclusive. So the most important thing to work on is the thing that is keeping the client from confidently speaking in any context with any person. Again, to me, the ultimate goal of speech language therapy is that the person can communicate what they want, with who they want, with whom? No, no, no. They want under any circumstances that they can imagine. So if the person um, doesn't really feel anxious or upset or any kind of way about stuttering in front of their friends, then that's not something you need to work on. If they feel super anxious and held back by the thought of stuttering in public, then that is definitely what you want to work on. If they have reached a point where they're just very comfortable with stuttering wherever, um, then as far as I'm concerned, you're done. Uh, Sometimes folks who stutter, it's about just making stuttering easier and faster because they get frustrated with how long it takes them to say something. So it's not about completely getting rid of stuttering, it's about making it more manageable. So any tips and tricks and techniques that we can work on that just make it a more manageable um, and make communication more efficient, um, then that's what we do. But again, um, that's because that's what the client wants. So one of the other questions, um, uh, where was it? Oh, are we trying to correct for the client and their feelings, or are we attempting to make it easier for other people to communicate with them? As far as I'm concerned, it's about the client and their feelings about their stuttering. And I kind of feel like if someone doesn't like their stuttering, that's really on that person. It's the same as somebody not liking the fact that I have brown eyes. I really don't care. That's not my problem to, make them more comfortable with the fact that I have brown eyes. That's for them and their mental health counselor to take, to work through. Um, and somebody else's discomfort with stuttering, as far as I'm concerned, is for them and their mental health um, counselor to work through. The concern I have is for the impact that behavior may have on my client, in making it so that my client is not made to feel less than because they stutter. Okay, so what can we do to educate parents on communication strategies with their child who stutters outside of therapy? So those are the kinds of things that we talk about. And as much as many of you hated um, the stuttering in your child advice for parents video, um, a lot of times, all right, hold on. I'm going to save that because I promise I'm getting to it. It's on the next slide. Um, so I probably should have put that question on the next slide. Sorry about that. Okay, after the assessment is complete, if the clinician does make a diagnosis of stuttering, do we set a time aside to educate? I don't know what I even just said. That didn't sound right though. Set time aside or to talk to the family. So one of the other things when I was a beginning clinician that it took me a while to really incorporate into my way of thinking was that the assessment, the diagnostic, if you identify that your client is having a communication disorder of some kind, the diagnostic becomes basically pre-treatment, because that is an opportunity as you are sharing the results of the diagnostic to talk about what will happen during treatment, what kinds of things you would like to cover during treatment. So at the time that you're sharing the results of your evaluation is a great time to talk to families about, and here are some things that you could be doing with your child and things that we will talk about more during treatment. Um, okay, I think I skipped some. Hold on, let me make sure I didn't. All right, so that's outside of therapy, set aside time to educate the parents. Um, I talked about that. Um, okay, so because stuttering is a persistent condition, um, how can we treat the individual to ensure maximal improvement in their daily life? Well, again, that comes down to your treatment collaboration and finding out from your client where does stuttering impact their life the most, and where under what conditions does the person who stutter want to stutter less, or if possible, not at all. Um, and then that is all about addressing that impact on daily life. How can we best advocate and counsel our patients who experience stuttering? Listen to their experiences, listen to what they have to say about what it is, listen to their lived experience. And help them build their confidence and acceptance of themselves. Um, that's again, that's the constant conversation you have as part of your treatment collaboration that becomes, so we've been working on X, Y, or Z strategy. Have you been able to use it? And if the person's like, no, I hate it, okay, that's not going to work. Do you feel more confident when, now that you're getting, it's getting easier to use? Do you feel more confident walking into whatever speaking situation has been problematic? And if the answer is no, I'm more stressed out because I'm afraid I'm not going to use this strategy, then that's not working. Then you need to circle back and try something else. Okay, so I think this is the last. Well, not quite. Okay, so what is more beneficial for a child, both developmentally and in regards to fluency? Should the stutter not be addressed and only focus on slowing down the rate? And should the difference between smooth and bumpy speech be directly addressed? Should the clinician focus on building the child's confidence in communication as is, or cue the client throughout speaking to address the disfluency? So I think that really depends. As far as I'm concerned, if I have a client, and usually these are preschoolers or very young children who stutter, or children that are very close to the onset of stuttering, who is completely unaware of their stuttering, um, it's not having impact on their daily lives. So me drawing attention to it, I don't feel like is really where it's at. If I can do things to manipulate the environment to make them more likely to be fluent so that communication is easier for them, then that's what I'm going to do. Because here's the thing, I want you guys to try, just for 30 seconds. I want you to monitor your speech and try to count how many times you use the word the or the article a, and see how easy it is or not to self monitor. Now, add on to that the fact that we're asking people, like, again, if we're talking about preschoolers, and if the onset of stuttering is between 2.5 and 3 years old, let's say we're working with a 4-year old who is blissfully unaware of their stuttering. So at the age of 4, let's say this child had completely typical development. They started speaking, like said their first word at the age of 1. That means that by the age of 4, they've had exactly 3 years of life experience using words to communicate. So now we're going to take somebody with exactly 3 years of life experience using words, and ask them to monitor their speech and identify the bumpy words versus the smooth words. Um, that is not an easy task. Um, it draws attention to something that they are blissfully unaware of. Um, and uh, it requires a cognitive effort that places demand on a system that we already know doesn't have a capacity to be fluent. So that's a really long-winded way of saying that if a child is not aware of their stuttering, then making them aware of it, I don't feel like is the best course of action if we can just change things in the environment or do um, proactive strategies like reducing rate or length and complexity of utterances and things like that. The other things that we know contribute to fluency, rather than having to use a stuttering modification strategy, which is extremely hard. It's extremely hard for adults to do, and they've been using words to communicate for many, many years. Um, so just keep that in mind, and try it. Before you ask your client to do anything, you should try to do something similar. Okay, so how do you provide therapy for people who stutter when their goal is to freely stutter? You help them work through and set goals. There are different things you can do to set up, like situational hierarchies and things like that, to um, let them know, or to help them work through that goal. Like, okay, so um, for instance, I've worked with a woman who stutters, and one of her goals, and her the ultimate goal was to get her to stutter more freely. And so we started out with she was a server at a bar, and we started out having her just introduce herself when she walked up to tables, and being okay with it, whether she stuttered on her name or not. So we build our goals around it. That is not our only job as speech language pathologist, is to stop stuttering. Our goal is to make people effective and happy communicators. Okay, I think I've answered these questions in some version or other. All right, so moving on, blaming the parents. Okay, so you, there were lots of you who got really had great empathy for the fact that the stuttering in your child advice for parents um, addressed the guilt that assumed that parents were feeling guilty about the fact that their child stutters. So I will tell you that in all of the families that um, I have met, who have children who stutter. The only people who had no sense of parent guilt about the fact that their child or family member was stuttering were foster parents, because the ones that I met hadn't been in the child's life long enough to have any sense at all that anything that they may have done genetically or behaviorally contributed to the fact that their kid stutters. So um, I can tell you as a parent that parent guilt is one of the most crushing aspects of being a parent. So, all three of my kids have ADHD, um, because I have ADHD, and there's certainly a genetic component to it. And so there are times when I see them struggling with ADHD related things, and I do feel bad because I did give that to them. They uh, they have it because I have it, and they have a healthier version of it because their dad also had it. So there is some guilt, and some of the other things they struggle with. Let me tell you, as a parent, you can go down the rabbit hole of guilt all day long. I've had moms during the interview. I used to do early intervention too, break down in tears, and, things like, I know it was because I was drinking wine and I didn't know I was pregnant. And then I found out I was pregnant, but it was too late. Or I knew I shouldn't have been drinking coffee while I was pregnant because caffeine is bad, or I ate sushi that one time, or the whatever. Parent guilt is, or there was the time when I completely lost my cool and yelled at Precious Peanut because he was screaming his head off because I wouldn't give him candy in the line at Walmart. there there's a lot of guilt to be had as a parent, because it is the only circumstance where you are 100% responsible for the soul and the body and soul of this other human being. So when things do not go as expected, it is very easy as a parent to wonder what you did wrong. Um, and I think it's a really pervasive reaction. So that particular video came out of the combined lived experience of the clinicians who made the video, the experiences that they had with parents. And actually, the whole purpose of that video is to tell parents that they are not to blame for the fact that their child stutters, and to give them. So one of the other things that I have found is that if you give someone something to do, um, it helps them feel more hopeful and um, less oppressed by what's going on. Like my sister and I talk about this all the time, is that when you have a problem, the best feeling is when you have a plan to deal with it. And because you are moving forward to address the problem. The worst problems, like being a parent, are the ones that you can't do much about. I can't change the fact that all three of my kids have ADHD, but I can change how we address it. Um, so that was the purpose of this video, was to give parents things that they could do that would help their kids be more fluent. And 100%, maybe it's because I'm old and I know the people who made this video, and I absolutely, these are things that I would still tell parents to do. And these are absolutely things that we do still tell parents to do. And in terms of providing routine, so there's a difference between routine and schedule. A routine is the thing that you do in a certain order um, every day. A schedule is something that is bound to time. Some families do well with schedules, some families do well with routines. I will tell you, living in a pack of ADHD people, routine is good, schedule is not a thing. Um, so routines are important, and having time to decompress is also important. Many families spend a lot of time um, moving from one activity to the next at a very frenetic pace, and that causes stress for everyone. And you guys probably can think about times when you are moving. I am guessing that this would be a really pivotal time to illustrate that, where you have to move from one task to the next, to the next, to the next, and you don't have time to unwind. And it does catch up to you, and it catches up to you the same way it catches up to little kids. So bear that in mind. You absolutely don't want to blame parents, but you absolutely do want to give them things that they can do so that they feel a sense of um, power over um, stuttering and power over what is happening to their child, whether their child completely stops stuttering or not. Um, if you can help reduce the stress and the family around the stuttering, everybody is better off. All right. I think I've answered them all, and I'm looking at this, and it is now almost an hour and 26 minutes. So I'm super glad I recorded it, because if it took me an hour and 26 minutes to say it, it would have taken me probably 4 times as long to write all that out. So I hope this was helpful to you. I welcome your questions, and I really, really appreciate them. And I will keep trying to address them in whatever way makes the most sense to all of us. All right. Thank you so much.